Hey there, it's Dr. Kevin, author of the Hypothyroid Diet. Today I want to discuss with you a little bit about this diagnosis of thyroid conditions and adrenal fatigue. There are a lot of people that think they have a thyroid problem, when in fact it turns out that they don't, or they may have an underlying adrenal fatigue issue that's really causing them to retard their progress with their hypothyroidism. You know, it's great that people like yourself is doing research, and I really encourage you to do research because unfortunately there are not a lot of physicians out there that are well versed with adrenal fatigue or hypothyroidism. But here's the thing, I'm going to help you distinguish between the two. There's one key factor that helps determine if someone has adrenal fatigue or hypothyroidism. Now, blood tests help in doing lab panels. Matter of fact, the 24-hour cortisol level will help identify that. But, you know, that's for physicians to do. For you, you need to keep a journal on your symptomology, specifically your fatigue, right? It's the number one symptom when it comes to thyroid conditions and adrenal fatigue, hence adrenal fatigue. But here is the pattern. Here's what happens. Now, a lot of people are slow starters in the morning. We have a hard time getting out of bed. I mean, no one really pops out of bed and is eager to go. We all need to get started a little bit slower, but I'm talking about fatigue in the mornings, meaning you definitely need caffeine to get going in the morning, and you can't get to work or really get going until 9 or 10 in the morning. It's just consistent, and it always happens, and you can't get up. So that's how you feel early in the morning. By noontime, you're feeling a little bit better. I mean, sometimes you'll have an afternoon dip, but here's the key as well. Evening time comes, after dinner, 5, 6, 7, 8, 9, even 10 o'clock. You feel the best you felt all day. So you're an evening person. You may even have issues sleeping at night because adrenaline is still pumping, or you have issues with your blood sugar. So this is the pattern of someone with adrenal fatigue. If you're having the sleep issues, if you're consistently just fatigued in the morning where you need caffeine every single day, and then you start to get that rise in the evening, this is a typical pattern of someone that has adrenal fatigue. So document it. Pay attention to the times when you feel great, times when you don't feel great, and this will give you an idea of what your cortisol levels will look like. So I encourage you to do research, but just don't diagnose yourself, but this will help you. And you need this information and ammunition when you go talk to a physician. And make sure you talk to someone that has an idea about adrenal fatigue, because a lot of physicians are really unfamiliar. Anyway, I'm not going to ramble on. Hopefully this information has helped you. Give me a thumbs up on this video if you liked it. Leave a comment or question below, and I will answer those as fast as I possibly can. Until next time, I want you to eat well and be well.